Well, hello. It's been so long, and I'm so sorry about that. But welcome to My World Monday. I can't wait to tell you about virtual therapy. I got the lowdown. Check it out. Okay, so the most requested bit of information I've been getting since the start of COVID and since I have had my son Amari, who is an amazing little boy who just happens to have Down syndrome. I typically get the question about therapy. So, how's therapy going? Is it virtual? Are people coming into your house? Is it hard? How's it going? Do you see it working? And this video is all about that. So, number one, question number one is it virtual or am I in person? And I guess you could imagine the answer to that question is it is all virtual. All virtual. Amari has 3 therapies a week. And that gets pretty difficult to manage with our schedule. We've been homeschooling 2 children. We've been managing full-time jobs. We've been doing all of the important things of just keeping a family going during this time. And we've been taking care of Amari pretty much full time, although we get help a couple days a week. And doing therapy 3 days a week. So it is a lot on us to manage, but we take pride in it. We've seen a ton of progress, and therefore we are really intentional about how we include therapy for Amari. So, first question and first answer, is it virtual? Yes, it is virtual. And that means it is all on us. Just to share a little bit about what that looks like, I'll take an example of just one therapy. So we may have occupational therapy one day in the week. And what that looks like is us going on Zoom or FaceTime, depends on the therapist. We have the opportunity to connect with them. The meeting starts with us just updating the therapist on how the week has been. And for us, we're really intentional about our practice with Amari. So, although practice is embedded pretty authentically into his everyday experiences and his everyday play, we most certainly make sure it's in the back of our mind when we're doing things with him and making sure that we can speak to the therapist about what he has done and how he's been accomplishing some of his goals and what he's still working on, even though it is very much a part of our fluid week. And so we start our meetings by sharing that update. Once we share what he's been working on, that typically sparks us to continue talking about what he needs to work on or what we're seeing him do developmentally. And then that goes into well, let me see. So the therapist will often ask, well, let's see this in practice. And so we will kind of like create an opportunity for him to practice. And so let me give you an example of that. So let's say Amari is practicing using his pincer grip, which is a fine motor skill. We may put him in the high chair, give him some Cheerios, and give him the opportunity to kind of pick those up. And that's a great example because it's a real one that we're doing right now. Amari tends to use the rake kind of method when he wants to grab at something. And that's because he is still working to develop the fine motor skills. And so children with Down syndrome sometimes have something called hypotonia. And so that just means that their muscles are pretty flexible and they need to work on strengthening them to do some of the really simple tasks that maybe a typical child might be able to do at a particular milestone marker. And so he has to just practice that a little bit more. And so that pincer grip is actually one that we're working on. Another way that we'll kind of authentically practice that is we'll throw Cheerios into a ice tray, obviously with no ice in it. And the tray, you kind of acts as a smaller, more constrained space for him to kind of use in order to pick something up. And he can't really use that method that he goes for all the time. So that might be one of the things we practice real time with the therapist right there in front of us, and then the therapist will just give us feedback. So it's a constant like giving feedback to the therapist about the week, then getting feedback from the therapist in real time, and then practicing that in real time so that we have a grasp on what our next steps are as we move into the week. So another therapy that we have during the week is we also have speech and language therapy, because we are actively working on sign language with Amari and giving him the opportunity to communicate with us using his gestures, because he's already shown us that he can mimic. He does a lot of finger play songs, a lot of row, row, row your boat. If you've caught that on any of my Instagram stories, you've already seen that. And so because he's mimicking, we've started to incorporate sign language. And so he can sign eat, he can sign more. We've introduced play and thank you. Um, and I'm getting ready to introduce no and stop. but but it's also enjoyable because we've learned to incorporate our older children into his play and his therapy. Um, we make sure that they know the schedule for Amari's therapy, and we make sure that if they want to participate, that they have already met the therapist. The therapists know them, and we make sure it's clear to whom we're working with that this is a family affair for us. And so, if you can find a way to teach our older children how to really practice and interact with Amari, then all the better. So it's really been an enjoyable experience. Okay, so second question I get all the time around virtual therapy is it a lot of work? What's it like? Um, how do you create your schedule? So yes, it is a lot of work. It's a lot of work on the parent. It's a lot of work on the family, because we are taking our cues and our guidance from someone who's looking at us through a camera, and they're not able to really be hands on at all. And so, if they're wanting to see a particular practice, or they're wanting you to incorporate something to develop a skill or further develop a skill, that means they're telling you about it, trying to model it, and then you're trying to then practice it. So if it's not really well explained, or if that there's not a true connection between you and the therapist, it probably isn't enjoyable. I'm lucky enough to have a therapist that I like. All of my therapists I really like, and we communicate very well with one another. So if I'm not understanding something, I just say like, I don't get what you're saying. Could you try it on a doll baby at your house? I don't know. Or I will say in real time, like, oh, I got this. Yeah, we already practiced this. Let's move on to something else. And so that communication is really meaningful. The other thing that makes it hard is that you have to practice. You have to authentically create ways to practice. So obviously, Amari's only about 14 months old. So we don't say, hey, Amari, it's 5 o'clock. It's time to practice your walking forward, right? No. But when we are playing with him in everyday situations, or just sitting on the floor with him and some toys, we practice the things that we were introduced during the week in one of his therapy sessions. So, sign language is incorporated into eating time or bath time. Song play is incorporated into any morning routine or afternoon snack. Um, Walking forward and practicing walking forward, which is something we're doing in physical therapy, is incorporated in playing with him while we are going about our day and maybe watching Monday Night Football. I mean, it is a part of our life. He is a part of our life. So we all try to find ways to incorporate his practice inside of our lives. And the third question that I get is, do I find it worth it? And I think you can tell by the majority of this video that I absolutely find it worth it. You know, I wasn't really sure about the journey I was embarking on, and there was a little bit of fear. And so it's all the reason why I put these videos together, because I don't want another mom, dad, grandmom, whoever to go into this journey with fear in. So I'll talk to you soon. Thanks for watching.